Brainstem anatomy, simplifying cranial nerves and vascular supply. A 55-year-old man comes into the emergency room with sudden onset dizziness, slurred speech, and difficulty swallowing. He has a past medical history of hypertension and a 20-pack-year smoking history. His physical exam demonstrates diminished gag reflex, difficulty with finger-to-nose testing on the left side, reduced pain and temperature sensation on the left side of the face and right side of his body, and finally, left ptosis and meiosis. Given the rapid onset of symptoms and crossed face and body signs, a brainstem stroke is high on the differential. Brainstem anatomy can be complex, with numerous cranial nerve nuclei and a unique vascular supply. The Rule of 4 technique, created by Australian neurologist Dr. Peter Gates, simplifies brainstem anatomy and helps in lesion localization based on clinical findings, enabling rapid diagnosis and appropriate management. The brainstem consists of the midbrain, pons, and medulla. The various pathways that traverse the brainstem and the cranial nerve nuclei contained within it can be simplified by the rules of 4. The rules are: number 1, 4 midline structures that start with M. The structures and associated deficits are motor pathway, contralateral arm and leg weakness, medial lemniscus, contralateral arm and leg vibration and proprioception loss, medial longitudinal fasciculus, ipsilateral internuclear ophthalmoplegia, motor nuclei and nerve, ipsilateral weakness of motor cranial nerve involved. Number 2, 4 side structures that start with S, spinocerebellar pathways, ipsilateral ataxia of arm and leg, spinothalamic pathway, contralateral loss of pain and temperature sensation of arm and leg, sensory nucleus of cranial nerve 5, ipsilateral loss of pain and temperature sensation of face, sympathetic pathway, ipsilateral Horner syndrome. Number 3, 4 cranial nerves in the medulla, 9, 10, 11, 12, 4 in the pons, 5, 6, 7, 8, and 4 in and above the midbrain, 1, 2, 3, 4. Number 4, 4 motor cranial nerve nuclei that are near the midline are the factors of 12 except 1 and 2. 5, 7, 9, 10, and 11 are in the lateral brainstem.
Any medial brainstem syndrome affects the 4 M's and the respective motor cranial nerve. Any lateral brainstem syndrome affects the 4 S's and ipsilateral loss of the respective lateral cranial nerves, or the cranial nerves on the side. Associating a lesion location with a vascular territory can be done by following a simplified vascular supply pattern. For medial structures, the midbrain and pons are supplied by paramedian branches of the basilar artery, while the medulla receives blood from the anterior spinal branches of the vertebral arteries. The lateral structures have a different pattern. In the midbrain, blood comes from branches of the posterior cerebral arteries. In the pons, from circumferential branches of the basilar artery, and in the medulla, from branches of the posterior inferior cerebellar arteries. Keeping the rules of 4 in mind, we can localize the region of the brainstem that has been affected. The case provided earlier had slurred speech and difficulty swallowing, which can be attributed to cranial nerves 9, the glossopharyngeal nerve, and 10, the vagus nerve, respectively. These cranial nerves are part of the lowermost 4 cranial nerves and can thus be localized to the medulla. As they cannot divide into 12, they localize the lateral medulla. Next, the ptosis and meiosis point to sympathetic pathway dysfunction along with the loss of sensation to the face and body, suggests damage to the sensory nucleus of cranial nerve 5 and the spinal thalamic tract. These are the S structures that point to the side or lateral medulla. Using the rules of 4, one can use the findings on physical exam to localize areas of dysfunction within the brainstem. Matching the area dysfunction with the vascular distribution can help with localizing and diagnosing a specific brainstem stroke syndrome. Other brainstem pathologies, such as infections, space-occupying lesions, or inflammatory disorders, can also be localized based on the rule of 4 depending on clinical context and symptoms, tempo, timing, and frequency. But the rule of 4 was created specifically for vascular injury as highlighted in this case. The acute tempo of symptoms and vascular risk factors of hypertension and smoking suggest that the patient experienced a stroke, specifically to the lateral medulla supplied by the posterior inferior cerebellar artery. For more information on the rule of 4 in diagnosing brainstem syndromes, please see the course resources. For more information on this and other neurologic conditions, please visit aan.com/NeuroBytes.